Give me just 1 minute. Okay. All right. So I hope you guys are ready for this afternoon. Okay, that's one. It will be MCQ question. Okay, 60 question. And you need to be in the meeting room at 2:15, right? And then 2:30 the clock will start automatically on Putra Blast. Okay, so it will take about 75 minutes. Okay, for you guys to submit. Okay, so it will be one attempt. Okay, per one attempt basically. It's not like assignment, you can do multiple attempts, so there will be one attempt. What else? Any question on today's this afternoon's test before we start the lecture? Okay, so whatever in the lecture today, okay, will not be covered, okay, obviously, but some of it, okay, actually some of it probably will appear, okay, in the quiz, because basically the general overview of the immune response. Okay, we will also look at it today, okay, towards the hypersensitivity. So probably some of whatever I taught today will actually like come out, okay, in the MCQ, right? So I hope you guys can pay attention, right? Hopefully, probably if you are lucky, okay, one or two questions will appear, okay, on the MCQ. Okay, so let's start. Okay, so today we will learn about previous studies. Okay, you learn about the general overview of immune response, right? And then the immune responses towards the different types of pathogen. Okay, you have covered virus, okay, bacteria, parasite, fungal, okay, and also you covered, okay, with Prof. Rahman, cancer, immunobiology. Okay, so today it is about immune system. Okay, in some condition, okay, they can overreact. Okay, so this is what we call as hypersensitivity, okay, and allergic reaction. So by the end of the lecture, these are all the learning outcomes that I hope you can achieve. Okay, so whenever you want to actually study for final or for test 2, okay, these are the things that you need to make sure that you cover it. Okay, so the different types of hypersensitivity reaction, so how many types are there? Okay, so the mechanism of each reaction and example of disease, okay, for each type. Okay, so we know that enemies, okay, in the environment is in the form of microbes. Okay, so you have learned about the immune responses against the different pathogens. Okay, but some of them are actually in the form of chemicals. Okay, and they constantly attack, okay, our bodies, disrupting homeostasis, right? So sometimes this homeostasis, okay, is disrupted on its own. Okay, so for example, okay, immune system homeostasis, okay, when the immune system starts to react to self proteins, means that our body recognize our own the component of our own cells, for example, the nucleus, the what else, the histones, for example, okay, then it will cause autoimmune disease, which I will cover in the next lecture. Okay, so in some occasion, okay, it may underreact. Okay, so as for example in FIV infection, okay, feline immunodeficiency virus, okay, similarly to HIV, it causes immunosuppression because the virus itself attack, okay, our immune responses. Okay, for example the CD4 T cells. Okay, but okay, in another occasion, it may overreact, okay, to antigens, okay, which we will cover today. Okay, the topic, which is hypersensitivity. Okay, so what is actually hypersensitivity? So it is a state of altered reactivity in which the body react, okay, with an exaggerated immune response. So it's basically overreaction, right, to a foreign innocuous agent. Okay. So anyone knows what is innocuous? Ada sesiapa tak? What do you understand about innocuous?
Not harmful.
Sorry?
Not harmful.
Yes, not harmful. So it's basically present present in the environment. Okay, so some of you probably allergic to seafood, right? So seafood, I mean the food that we eat almost every day, okay? So it should be not harmful, okay? But somehow, okay, in some individuals, okay, they can overreact, okay, to this foreign innocuous agent, okay? So as I mentioned, okay, there are different types of hypersensitivity reactions, okay. So based on Gel and Coombs, okay, classification, so they are actually immunologists, okay. So they actually found about all these different types of hypersensitivity. So they categorize it, okay, based on the different mechanism, right. So these are the different. See, okay, so see, okay, so these are the so these are the different classification of hypersensitivity. So there are 4. Type 1, okay, which is IgE mediated. So when you are exposed to antigen, okay, the onset is within minutes. So it is what we call as immediate, okay. And then we have type 2, okay. Type 2 is actually IgG and IgM and also complement mediated, okay. So it is the antigen, okay, is on cell surface, all right. So versus type 3, okay, so type 3 the antigen is soluble antigen, right. So the onset is also within minutes, okay, or a few hours of antigen challenge. So it's a bit longer, okay, in comparison to type 1, okay. And then you have type 3, okay. Type 3 is actually immune complex disease. So again, antigen and antibody, okay. So the same with type 2. So but the antibody is directed on the antigen which is on cell surface, versus type 3, okay, the antigen, okay, is soluble. So the antibody is also soluble, okay. So the onset is usually within 2 to 6 hours, okay. So versus type 4, okay, T cell mediated, so it is peak by 24 to 72 hours. So it is a bit longer compared to type 1, 2, or 3. So it is also called as delayed, okay, type hypersensitivity. So from this, okay, you can actually see the differences between type 1 through 3 versus type 4. What is the main difference, okay, that you can see in comparison?
Duration.
The duration.
Sorry?
The duration.
The duration, yes. Okay. Other than that?
Type 4 requires T cells.
Okay, type 4 require T cells, right? So type 1, 2, 3 are antibody mediated. Okay? Alright, so I hope you can see those differences. Okay, so let's go to type 1. Okay, today we will only cover on type 1 because type 1 is the most actually prevalent type of hypersensitivity compared to type 2, 3, and 4. So a big chunk of the lecture is focused on type 1, right? So before that, before we go to type 1 hypersensitivity, okay, so let me tell you a story. Okay, so this is me, okay, back in 2008, okay, when I first arrived in the US, okay, to do my PhD, okay, so that was chubby me, okay, all right, so I was just got married, so probably I was so happy, okay, so I was a bit chubby back then, right, so this was the picture of my first spring, okay, I'm not sure what is the flower. I think it's daffodil. I'm not sure. Okay, but anyway, okay. So I was happy. Okay, on my first year. Okay, because it was winter before. Okay, and I was like so depressed. Okay, with the weather. It was like very cold, and I was not used to it. So when it came to spring, okay, I was so happy, and then I was enjoying the weather, right? So it was nice, okay, but in California. And then okay, first year it was okay, and then the second spring, okay, second year spring, okay. So I started to sneeze, okay. Started to sneeze, and then it was mild, okay. I took anti, and then it went away, right? By third year, it was it was I would say that not severe, but it was not like the second year where I was like just sneezing, and I will recover with antihistamine. It was like I have to take antihistamine for few days, okay, only that it will disappear and then it will come back, okay. And then I was there for 5 years. So by fifth year, it was like so horrible. Okay, so even antihistamine, I cannot. I mean the symptoms was not resolved. Okay, with just antihistamine. So I need to do nasal flush. Okay, so I just bought in at the pharmacy this normal saline. Okay, so flushing my spraying my nose, okay, so basically it will clear all the whatever antigen, okay, that was stuck, okay, in my nose. So later, okay, I found out, okay, probably that I was actually allergic to pollen, right? So why during my first year and second year it was milder, okay? Why do the subsequent spring, okay, it became severe, okay? So this relates to type 1 hypersensitivity mechanism, right? So as I mentioned, it is called immediate, okay, hypersensitivity, okay? It is also the basis of anaphylactic shock, okay? So if you learn, okay, in your medicine class, okay, anaphylactic reaction, so this is the basis of it, the mechanism of it. All right, so during my first spring, okay, this is what happened. So I was first exposed to pollen, okay, the picture with daffodils, okay, just now. So I didn't know that I was actually allergic to pollen, okay. So when I inhale. So there was extraction of antigens, okay? Then the APC take up the antigen, right? And then, of course, as you know, okay, it will actually be presented to T cells, okay? So there will be activation of antigen-specific T cells, okay? So these T cells, okay, in allergic reaction, okay, it will induce the type Th2 reaction. So it will actually the Th2, okay, will actually produce IL-4, okay, which will activate the B cells, okay. So the B cells will actually produce, okay, IgE. Okay, so the IgE will actually bind, okay, to these mast cells. Okay, so the mast cell contains Fc, okay, epsilon, okay, receptor 1, right? So it will actually attach, okay, to this receptor on the mast cells. Okay, so this period is what we call as sensitization. Okay, so induction of IgE antibody. So there is as I mentioned during my first spring, okay, I don't have any symptoms, okay. So this is the period of sensitization. So it just induced the IgE antibody. So what happened during the subsequent years, okay. So in the next spring, okay, I was re-exposed again, okay, to pollen, okay. So this pollen, okay, is an antigen, okay, will bind, okay, to this mast cell that is expressing the IgE, okay. So once it binds, it will cause degranulation of mast cells, okay. So mast cells, if you see from under the microscope, you can see that it contains a lot of granules inside, okay. So once it the antigen binds to the IgE, okay, that is already attached on the mast cells, okay, it will release, okay, the granules will degranulate and release these molecules, okay, vasoactive molecules, chemotactic molecules, okay, enzymes and cytokines, okay. So I will there is a slide, okay, later that will explain all these molecules, okay. So what will what will lead, okay, after the degranulation is acute inflammation and also systemic effect, okay. All right, so this is what we call as cross-linking of IgE, okay, by antigen, okay. So on these mast cells, okay, so basically the antibody can bind to different antigen, okay, because to different antigens or the same antigen with different epitopes, okay. So this is what it means by cross-linking, okay, of IgE by antigen. All right, so what were the molecules released? Okay, so these are, okay, the one that is in red color is actually pre-made, means that it's already inside the granules, okay. So once the antigen, there is cross-linking of IgE by the antigen, then it will be released immediately. So such as enzymes, so tryptase, okay, kinase, these are all proteases. So basically it will be cleaved, okay, and then it will cause remodeling of connective tissue matrix. Then you have the toxic mediator, okay, which actually cause all the symptoms that you see. Histamine, okay, or heparin, okay, so it increased vascular permeability, okay, and it causes smooth muscle contraction. So basically, histamine will cause increase of fluid, okay, going out, okay. So basically, increased vascular permeability, okay, and then these are all the product, okay, that you will see in the event of infection, okay. So this is why you will see here, okay, toxic to parasites, okay. So I think Prof. Rahman already also touched, okay, on parasites, okay. So these are all the mediators that also, okay, plays a role in parasites infection, okay. And then TNF alpha, okay, they are already preformed, okay, in the granules. And of course, it promotes inflammation, okay, it stimulates cytokine production. So it will stimulate, basically it will stimulate cytokine production by eosinophil, for example, and it activates the endothelium, means that there will be migration. Okay, when the endothelium is activated, there will be migration of cells. Okay, migration of immune cells. Okay, from the blood. Okay, to the site of allergic reaction. Okay, so you have the cytokines. Okay, for example, the IL-4, which will stimulate and amplify more, okay, Th2 cell response, okay, IL-3, IL-5, okay, it will promote eosinophil production and activation, okay. Remember, okay, what are the 3 cells that are very important in parasitic infestation? 3 important innate immune cells.
Eosinophils,
So mast cells is one of them. Okay, eosinophils.
basophils,
Another one?
basophils.
Okay, basophils. Yes, okay. Good, good. Okay, so basophils is also like mast cells, okay? It will be activated, okay? It will also release granules, okay? When there is cross-linking of IgE, okay, by the antigen, okay? But eosinophil, okay, it will comes in later, okay, during parasitic infestation or during allergic reaction, okay, because it needs the cytokines to be released first before it can be activated. So these cytokines are released by mast cells, okay, and also basophils, okay. And then the chemokines, okay, which will attract more innate immune cells like monocyte, macrophages, and neutrophils into the site of inflammation, okay. Now you have the lipid mediator like leukotrienes, okay. So this is actually the function is similar like histamine, okay, but leukotrienes is 100 times more potent, okay, than histamine, okay. And then it is usually comes a bit later because it's not pre-made, okay. The one in white color box, okay, is actually the one that is made, okay, after the degranulation, okay. All right, so you have the PAF, which is also chemotactic, okay. Right, so this is mast cells, okay. Once the mast cells release those cytokines, okay, for example, IL-3, just now IL-5, GM-CSF, okay, so it will activate the eosinophil, okay. So remember that eosinophils, okay, actually only activated, okay, later, right? So why is that? Okay, because eosinophil, the product is more toxic, okay, than mast cells, okay. So as you know that eosinophils, okay, the number of eosinophils in the blood, okay, is very low, okay, because of this, because it's highly potent, okay. Other than that, the resting eosinophils, okay, actually do not express the FC epsilon receptor 1, okay, the one that is expressed by mast cells, okay. So resting eosinophils will not actually have that, okay. Only that after activation that it will express this receptor, right? So and then resting eosinophils also do not bind IgE, okay. So this is the mechanism that will actually prevent eosinophils from excessively secreting its toxic protein because it's really potent, okay, compared to mast cells. So only after activation by mast cells that it will actually release these proteins, okay. So what are all these potent, okay, proteins, okay. So for example, like okay, this one again, the one in red is the pre-made, okay. So you have eosinophil peroxidase, okay. So basically it's toxic to parasites and mammalian cells, okay. And then it will also treat trigger more histamine release from mast cells, okay? And then again, this major basic protein is also very potent, okay? It will trigger more histamine release from mast cells, okay? And then you can see here cationic protein, which is neurotoxin, okay? Really toxic to the nervous system. So that's why, okay, I mentioned just now that eosinophils, okay, it is more potent in terms of its action against allergen or against parasitic infestation, okay, compared to mast cells. And you have the cytokines, again, the same cytokines, okay, which will amplify eosinophil production, okay. It will cause more eosinophil activation. Also, it will actually produce CXCL8, okay, which will is a chemotactic factor, okay, for leukocytes. And leukotrienes, just now, as I mentioned, similar function like histamine, okay, but it's more potent, right? Okay, so these are all actually made, okay, after the release of these enzyme and toxic proteins. Okay. All right. So this is one. This is what I want to highlight. Okay, on the timing. Okay, of the reactions that you see. Okay, in association with mast cells. Okay. Basophils and eosinophils. Okay, for example, this is a case of allergic rhinitis, or what we call as hay fever. Okay, so when there is inhaled antigen, okay, enter mucosa and activates the mucosa mast cells, okay. So again, the mast cell will become activated, and then it will cause, okay, blood vessel permeability and activation of epithelium, so that the immune cells, okay, will migrate, okay, from the blood vessels to the tissue, right? And then you will have your eosinophils, okay, later will be recruited, okay, from the blood, and then it will enter nasal passages with mucus, okay. So what happened? Okay, so this is actually the PEFR is actually let me I forgot like what is P. I think is let me check. Okay, is EFR is expiratory flow rate. Okay, expiratory flow rate. So it's basically, okay, the amount of air, okay, the amount of air that is being being released, okay, that is being released out of the lungs, okay, in one burst, okay. So P stands for peak, okay, so it's peak expiratory flow rate, okay. So is a measurement of the maximum speed with which an individual can blow the air out, okay, from one lungs, okay, in one burst, okay. So what happened? Okay, this is antigen challenge, okay. So antigen challenge, and then it will actually cause, okay, the reactions, okay, by the mast cells and basophils. So you can see that, okay, when there is actually mast cells activation, okay, it will cause, okay, muscle constriction, right? So which includes the respiratory muscles, okay. So it will cause, okay, reduce of airflow, okay, coming out, right? So you can see it dips here, right? After about 30 minutes, okay. So it's quite immediate, okay. And then it goes back to normal, okay. And then about 8 hours later, okay, it dips down again. So this is the reactions, okay, of the leukotrienes, okay, that is made after, okay, the preformed granules are released, okay, and then also the activation of eosinophils, okay, that release more histamine, okay, from the mast cells, and then also leukotrienes as well, okay. So this is what we call as Will and Flare reaction, okay. So the immediate, okay, so this is I think I will show you later on the skin reaction, okay, it's obvious there, okay. Okay, so when we said about okay, when we mention about allergy, okay, so there are characteristic of allergen, okay, that can induce IgE responses, right? So these are the actually the common features of allergens, okay, that will induce IgE responses. Okay, there are more ongoing research on this, okay, because sometimes one antigen will not cause allergic reaction, okay, compared to another antigen. So what are the common characteristics? So these are what people have found out so far. So usually allergens are in the form of proteins, okay, and because all in proteins will induce T cell responses. Okay, so allergens are often proteases. So once it is in the, for example, if we inhale the allergen, okay, in the mucosa, okay, so there are enzymes there that can cleave, okay, the allergens, and then usually it's in low dose and low molecular weight, okay, because these if usually low dose antigen will favor IL-4 producing CD4 T cells, okay, and also low molecular weight can cause the allergen to diffuse out of particle into mucus, okay. For example, like dust, okay, so it's actually not the whole component of dust that can cause allergic reaction, but a protein antigen, okay, a specific component of protein antigen that can diffuse out of dust, okay, and into the mucus, okay. So this is usually dry, okay, but once it is in the mucus, it will be eluted because mucus is wet, right? So it will be eluted, okay, from the particle, okay. So the allergen must be highly soluble, okay. And then it is stable, so allergen can survive in desiccated particle, like for example, I mentioned just now dust, okay, and some actually, like for example, cats, okay, they can have flea allergy, dermatitis, okay. So this is because of the component in the feces, okay, of the flea, okay, that contains the protein antigen, okay, which they can survive in dry particles, but once it is in the mucosal layer, okay, there will be wet surfaces, okay, that will cause the allergen to be soluble, okay. And of course, it contains peptide that bind host MHC class 2. Okay, so this is protein antigens, okay, that can be break up into peptides. Okay, so I hope you know by now, okay, what is the length of the peptides, okay, that can actually activate TH1, for example, okay, versus TH2, okay, versus TC cells, okay, all right. Okay, so usually, okay, so have you ever wondered, okay, why, okay, some people actually are allergic to seafood, some allergic to, for example, myself allergic to pollen, okay, so but some actually do not have any allergic reaction, okay, when they are exposed to pollen, for example, or when they eat seafood. So why do you think that happens? Anyone have any idea? Why some individual, okay, or animals have tendency to actually have allergic reaction? Okay, some even exposed to the same allergen, okay, they do not show any reaction. Why?
Doctor, is it because of genetics?
Yes, okay. So they are actually allergic reaction is not just immune responses, okay, so it's multifactorial. So genetics, so if the parents has genetic predisposition, there is a chance 40 to 60% chance, okay, for the child, okay, to develop, okay, IgE mediated allergy, okay. So this is what we call as atopy, okay. Atopy, which means that it has genetic predisposition, okay, to allergens, okay. So 40%, okay, actually in the world, okay, this is human, showed exaggerated tendency, okay, to allergens, okay. Right, and then also environmental factor, okay, plays a role. So for example, if you work, okay, in factory, right, that produce dust, okay, so your body will actually has a tendency to develop, okay, allergic reaction to dust, okay, because you know that the low dose, okay, so if you are exposed to a low dose of dust, okay, every day, okay, so somehow this will favor the allergens to induce IgE responses, okay. So okay, so right. So let's go to the effect of muscle degeneration. Okay, just now I already touched on this. Okay, so but if we see like for each organs, okay, it depends on where the allergens enter. Okay, so if it enters the GIT, so it will increase the fluid secretion. Okay. And then it will increase peristalsis. Okay, so basically because this is actually we go back to parasite infection. So this is the mechanism of how body want to expel, okay, the parasites, okay, from the gut content, right? So that is for the GIT. So airways, okay, the muscle activation will cause, okay, constriction of airways, okay, through decreased diameters, okay, of the airways and increased mucus secretion. So you will start seeing like sneezing, okay, coughing, and excessive production of mucus, okay, causing phlegm, okay, and in blood vessels, okay, there will be increased blood flow, okay, increased permeability, so that to allow the immune cells, okay, in the blood, okay, to go into the tissues, okay. So this is where the allergens resides, right, in the tissues, okay. So going back to the mast cells, okay, basophils and eosinophils, they are usually found in tissues, right? Okay, so okay, so in relation to the responses, okay, seen in mast cell activation, okay, it depends on where the antigen enter. Okay, just now if it enters through the GIT, you will see diarrhea, for example. If it enters through the respiratory, you will see sneezing, coughing, okay. So this is what it means by, okay, route of antigen entry with the clinical signs that is induced, right? So you see just now I mentioned about the local release of histamine causes wheal and flare reaction, okay? The wheal, okay, is actually, what is wheal? What do you understand about wheal? What do you understand about wheal? What is wheal?
Doctor, is it like an itchy area on the skin?
Okay, on the skin, yeah, okay. So basically, what does it mean by wheal? Induration, okay. So induration means that the accumulation, okay, of fluid causes the swelling, okay, under the skin, okay. So this is what we call as will. Okay. In allergic reaction, okay, you will see what we call as urticaria. Okay. That is actually okay more scientific word, okay, to describe will, okay, reaction. What about flare? What cause flare? What do you understand about flare? Flare is actually redness. Okay, so remember the characteristic of inflammation. So these are all inflammation. Okay, what you are seeing by mast cell activation is all inflammation reaction. Okay, the apa tu nama dia? Rubor. Okay, the Latin word rubor, color, delor. Okay, so basically it is swelling, okay, redness, heat, okay. So swelling is due to increase, okay, accumulation of fluid, okay, and then for the redness, okay, is due to increased blood flow, okay, to the site of infection. So this is what the basis of flare reaction, okay. So this happen, okay, in low dose, okay, if is the allergen enter through the mucosa of the skin. In inhalation, example just now I mentioned, okay, like allergic rhinitis or asthma, okay, you see this clinical signs, okay. Ingestion, you see diarrhea, okay. So what I want to touch here is, okay, when, okay, there is injection, okay, that cause rapid absorption, right, into the blood, okay. So antigen will diffuse into the blood vessel and is widely disseminated, causing urticaria, hive, or anaphylaxis. So anaphylaxis is the worst case scenario. So for example, you know that people are allergic to peanuts. Some people are allergic to peanuts, right? So it can cause, okay, anaphylaxis reaction because, okay, of this protein, okay, the peanut protein can actually be rapidly absorbed, okay, into the blood vessel and causing anaphylaxis, right? And also in some cases, okay, if the allergen enter through IV, okay, if you can see the left column here, okay, IV in high doses, right? So the mast cells in the blood will release histamine. So it will be systemic release of histamine. So when there is systemic release of histamine, okay, imagine, okay, uh, 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 there will be actually constriction, okay, of blood vessels, okay, generalized, okay, basically. So it will cause systemic anaphylaxis. So it is a worst case scenario in the form of type 1 hypersensitivity. Okay. So let's go one by one. Okay, so we have, just now I mentioned systemic anaphylaxis. So the antigen allergen is entered through IV. So what allergen can enter through IV? For example, drugs, okay, like penicillin. Okay, you know that some individuals actually are allergic to penicillin. Okay, you know that sometimes when you see doctor, okay, the doctor wants to prescribe you with antibiotic, okay, especially IV antibiotics, they will ask whether you are allergic to any drugs, okay, or penicillin, okay. So what cause, okay, after for example, if you are allergic to penicillin, okay, you were given IV, okay, penicillin. So the antigen in bloodstream will enter tissues and it will activate connective tissue muscle throughout the body, right? So it will cause the increased capillary permeability. So there will be a systemic, okay, swelling, okay, of tissues, then it will cause loss of blood pressure, okay, tissues, okay, and lead to anaphylactic shock, okay. And then because it's systemic, so respiratory tract will also you will see symptoms in respiratory tract. Okay, you will see to have difficulty in breathing. Okay, because of the constriction of the smooth muscle of the lungs. And then gastrointestinal tract, okay, there will be contraction of smooth muscle, okay, vomiting and diarrhea. So this is a medical emergency, right? So if you see that someone starts to have allergic reaction, okay, systemic allergic reaction, this is medical emergency, okay. So you know EpiPen? Have you heard of EpiPen?
Yes.
In movies, for example, I don't think like people carry people in Malaysia carry those, okay, probably in overseas, okay, you see that individual that know they have allergic reactions, okay, especially for example towards peanuts, okay, sometimes when they eat outside, okay, they do not know whether the food is processed with peanut, okay, so even a small dose, okay, will trigger, okay, anaphylactic reaction. So they usually carry this what we call as EpiPen, okay, basically it contains epinephrine, okay, they will just inject onto the thigh muscle, okay. So basically the EpiPen will reverse the action of histamine, okay, and then it will reform the tight endothelial junction so as to prevent the entry of fluid into the tissues, okay. So if you see here, okay, the blood pressure is once the reaction happen, okay, within minutes, okay, it will start to the loss of blood pressure, okay, you will see within minutes, okay. But then when there is epinephrine injected, okay, it will reverse, okay, the cause of histamine, okay, immediately, okay. Because you know that histamine, okay, how does it function is it binds to the H1 receptor. Okay, so this H1 receptor, when it is activated, it will cause the increased capillary permeability and then the smooth muscle contraction. So epinephrine will actually block, okay, the histamine, okay, before it binds to the H1 receptor, right? So that is for systemic anaphylaxis. So again, I mentioned just now, allergic rhinitis, okay, is a respiratory allergic diseases. It's a basically it causes only reaction on respiratory symptoms, respiratory system. Okay. Now you have asthma. Anyone has asthma here? So asthma is actually induced by type 1 hypersensitivity. Okay. So you probably need to have salbutamol, okay, inhaler, okay, Ventolin, okay, carried with you everywhere, okay, for especially for acute response, okay. So for type 1 hypersensitivity, okay, for acute response, okay, is actually fall under type 1 hypersensitivity. But for chronic response, okay, so for asthma, okay, it can cause chronic activation, okay. So it can be complicated by diseases, okay, such as viral diseases or bacterial diseases. You can see that people with asthma, okay, if they have respiratory infection, okay, by this pathogen, it will exacerbate, okay, the asthmatic, okay, condition, right? So this actually cause chronic response, okay, and this can also induce type 4 hypersensitivity because when there is pathogen infection, the T cells will become activated. So basically, I would say the asthma, okay, in acute response, it induced type 1 hypersensitivity, but in more chronic responses, okay, with complication of pathogen infection, okay, it can induce type 4 hypersensitivity, okay. So my cat actually have asthma. So you, I mean, you can see that if I mean, if if the cat has infection, okay, it will immediately trigger the asthmatic reaction, okay, and the same with human, okay. My cat also need to receive the oral, not the oral, the inhaler corticosteroids, okay, every day, okay, to prevent the asthmatic reaction from happening, okay. All right, so food allergy, okay, even in dogs and cats, especially we see in pets, okay, they can have food allergy, okay, if you actually give them, okay, the protein antigens that they are allergic to, okay, so they can have vomiting or diarrhea, okay, the classic example, and then they can have weight loss and also poor condition, okay. So in some animals, okay, in some breed, okay, dogs and cats, they can have what we call as atopic dermatitis, okay. Again, when you see atopic, means that it has genetic predisposition, okay, to it. So it is a chronic skin condition that cause itchiness, okay, which is due to excessive IgE production, right? So what is the therapy of type 1 hypersensitivity? So I mean, for specific diseases, okay, you will learn in medicine courses, but this is just the overall overview on how we can approach, okay, type 1 hypersensitivity individuals, okay. So basically the first thing, okay, is avoiding the allergen completely. So if you know that your pets, okay, is allergic to certain preparation of food, for example, like seafood, okay, so you may want to actually cook, okay, the food yourself. For example, like chicken has low protein antigen, okay, so usually like people will give chicken, okay, for those animals that have allergic to certain food, okay. And then, for example, if they are allergic to dust, okay, some are allergic to like dust, okay, so that you need to keep, okay, the environment clean so that to prevent, okay, the allergic reaction from happening. So that is what it means by avoidance of allergen. And you have hyposensitization, means that, okay, this is what we call as desensitivity therapy. Okay, means that you introduce the allergen, okay, slowly, okay, in gradual doses, okay, increasing gradual doses, okay, so that to promote, okay, type type sorry TH1, okay, activation, so that when there is TH1 activation, it will skew, okay, the balance, okay, towards TH1, okay, versus TH2 that which promotes the IgE activation, okay. So this is what we call as hyposensitization, okay, right? And then you have drug therapy, okay. For example, you can stabilize the triggering cells, you can antagonize the mediator, okay. So for example, for this is you can administer cytokines, okay, that promote the TH1 cells. Okay, so you antagonize the TH2 cells by giving cytokines that can promote TH1 activation. Okay, so and then also, for example, you can actually in human you can actually induce the response of Treg. Okay, remember T regulatory T cells. Okay, so yeah, when you actually induce the response of Treg, it will skew the response away from IgE. Okay, so this is example of what have been done in human allergy therapy lah. But I don't think in animal we have seen this, especially in Malaysia. Okay, so for food allergy, for example, there is a special prescription diet. I don't remember whether it's Royal Canin or Hills. Okay, which is can be administered. Okay, basically it's a hypoallergenic diet. Okay, so this is example of food that you can give lah for animals that have type 1 hypersensitivity. Okay, so these are example of skin testing for allergy. So you have wheal and flare reaction. Okay, you can see the wheal here. Okay, the increase of fluid in the under the subcut. Okay, so this is human. So this is dogs. Okay, so basically what skin testing what does it mean by intradermal skin testing is that you inject the different allergens. You can see here histamine, feather, cat, dog, okay, under the skin, okay, and then you will see reaction, okay, wheal and flare reaction. So this is against, okay, for example, histamine is the positive control, negative control is probably saline, okay, feather, okay, the cat fur, for example. So you know that this individual is actually allergic to this different protein antigen. Okay, this is example of dogs, but it's not labeled here. But this is the example of how you can test whether you are allergic to certain allergens. Okay. The other test that you can do is ELISA, okay, to measure IgE. But for ELISA, okay, because IgE in the serum has short half-life, so probably just 3 to 5 hours. So if you actually get the serum, okay, outside this window, okay, outside the 3 to 5 hours, you may miss, okay, the IgE reaction, okay. So that's why the intradermal skin testing is favored against ELISA because of the IgE half-life is very short, okay. All right, so that's all. Okay, I think you have another class after this. So I see you this afternoon at 2:15, okay, for your test. Right? Thank you very much. Any
Thank you,
questions?
Doctor.
Thank you, Doctor.
Okay.
Thank you, Doctor.
Thank you,
Thank you.
Doctor.
Thank you so much, Doctor.